You're listening to the Beauty Beyond Bella podcast, powered by Formula Wellness.
I'm your host, Dr. Yvette Suarez, owner and medical director of Bella Excellence, a diamond-accredited anti-aging med spa in the Tampa Bay, Florida area. On this show, we explore the latest trends in health, beauty, and anti-aging medicine while celebrating the inspiring journeys and achievements of our guests.
Hi, Jennifer. I am so happy to have you on the podcast. I feel like this is a conversation that so many people really are going to need. You come from the psychiatry world, and I think I need to start off with saying in today's world, most people are coming in to see you because they want medication, and there is not other therapies that they're thinking about they need or want. How do you navigate that before you put them on medications?
Well, there's different times they'll come in. So some will come in because they've tried other things and trying to improve on their own or try different modalities. So other ones come in and want a fast result. So something's happening. I don't know how to deal with this. Maybe they lack coping skills or the coping skills that they've been using aren't working. And now it's like, okay, medication because I need something right now to help me improve immediately. And it doesn't work that way. You know, I wish there was a magic pill, but there isn't. That's not reality. It's the learned behaviors and everything else that has to come into play.
So I would say then in your profession, you're going to have more talk therapy because they need to understand if there was past trauma, how are they going to get there, what happened in the past, and how are they going to improve that continuously in the future, which I think is really hard because it takes a lot of work on their part. And if they're willing not to do the work, then that's going to be even harder on you.
It's the hardest piece. So first, for my part, is the evaluation, right? So, okay, they're presenting, and are they saying that this is a new onset? Okay, so new onset, are they going to get medication? Not necessarily. We should find out why this is happening, right? So it's acute stressor. Okay, so let's deal with that. If it is something that's been happening for years at a time and they've maybe tried different things and it's not working, then the medication talk. But it has to be, what is your current situation? What are your coping strategies or your ability to handle stressors before? And then what do we need to do now? Like, how do we get you where we want you to be? And so that you feel a sense of peace, and that's the ultimate goal.
Yeah, that's so important because I think we all go through trauma in our lives, and there is a lot of stigma around the medication, and there's a lot of side effects. And again, just being transparent, I remember I lost my stepson back in the day, and I remember it took me a couple of months to go into a depression. And when I went to go seek for therapy, they put me on medication, and I didn't want medication. I didn't want to be on that. But I felt like, well, they obviously think something's wrong with me. I'm going to go on this. But I quickly realized within 2 months, I felt so blunted and I didn't want to feel unfeeling.
Right.
I needed to figure out how to cope with those feelings to get stronger, to be able to move past that.
It's true. So you have people that come in and they are in that situation and they are grieving or have a stressor that's significant. And they haven't had that recent or in the past or haven't related to anything else. So that's where you're going. So as a professional, it's how do I evaluate where your baseline is? Okay, how did you handle stressors before? Do you have the bandwidth to handle this now? And what can we do to get there? I'm very conservative. So I wouldn't in that situation, again, I can't speak to your provider, but I would not have given medication because at that point you didn't need it. You just needed to work the process, which is the grieving process, right? So we have to go from start to acceptance, and it's very hard. It can be very your timing is significant too, and everybody's different, but it's how you're going to handle it. So in that situation, probably not, but not every prescriber. You come in, you're presenting somehow, that's their answer if they want to say, hey, you're do this, immediately.
No, and I can see that. And doctors want to help right away. So they think, okay, like you said, they think there's a magic pill. But in reality, the studies show that 30 to 50% of patients only receive some treatment that actually feel better, that it's actually effective.
Correct.
Most of the time it's not effective, and you're bouncing around from different medications or combinations, which then increases our side effects.
Right. So then when you're adding, so a lot of folks do polypharmacy, right? So there's a big proponent to do polypharmacy as far as this medication has some side effects, so let me add something else because they're not getting full benefit or they need to complement it with something else. okay, well, what is that medication going to give for side effects? So you have to evaluate that and say, okay, what is best for this individual? And I think we need to do a more individual care in that perspective. But again, timing and everything else, and relying on you to give me the information, because that's where I'm going to evaluate and treat with, right? What you're giving me, this is what I feel, this is what I need, kind of conversation.
How do you, so it's probably hard once someone's on a medication. Is there a plan with, say, 1 year, 2 years? How do we wean these patients off effectively without them going back into the pendulum swinging back and forth into depression and anxiety?
So great question. So a couple things. So I always say I am going to read that we're going to reevaluate every time I see you. However, within 6 months, I want to see if your stress levels change, your ability to cope, what therapy are you taking on as well. Has your stressors changed, your environment, right? Because a lot of it is environment driven. So what does that look like? So in 6 months, we're going to say, hey, are you on the right medication? And is this something that we need long term? But anybody who I start with on medication, it's always like, this is not, I'm not telling you it's going to be forever. And I can't give you a time frame. But what I'm hopeful is that in 6 months, we can reevaluate and not need it as much, not be so reliant. But it depends on all of those factors that have big play on their overall ability to get through the anxiety or the depression.
And I appreciate that. I think, like everything in life, there's a plan, right? And we need to have that plan and have that open up that this shouldn't be a one and done. And there's a lot of work that goes into that. So how do you encourage them to do that talk track? How do you encourage them to do other things in their lives to get better so that they can get off these medications? Because, you're only seeing them this short period of time. How do they put in that work and become successful at it?
Right. So once a month, typically I'll see them, right? So in that snapshot is like, okay, what have you been working on? So when I see them, it's okay, if I'm starting on medication, my expectation is that you're going to have some type of therapy as well. So many of them will do it. Some will be a little bit not hesitant to do it for whatever the reason is. Could be cost. That's a big factor too. So if they are having it, okay, what are you working on? What is your treatment plan with the therapist? And where are we at as far as wins? And what do we still need for improvement opportunities? And then every conversation revolves around that. And then it's like, okay, what are you challenging yourself to improve? How do you want to improve? What does that change look like for you? And you kind of paint a picture. And then each month I'm saying, where are we at with this picture? Where are we doing? Are you doing the work? So it's more that I'm working through with their therapist just to kind of get to the same treatment plan. So kind of a checks and balances in that situation.
So are you able to work with their primaries or a wellness physician? Because we know, obviously, we're all nutritionally deficient. We don't eat well. Our foods are not great. And so we know that, low magnesium and B6, B12, iron, folate, all the hormones from thyroid to testosterone to estrogen and progesterone can cause increased anxiety and depression. I'm not sure that in many of these facilities are actually looking at the whole entire picture and saying, how do I fix all of it together and not just throw a medication at them? And sometimes even with them working through it, they're so deficient that they don't have the support.
Right. So correct. So what I do, they all do a CBC. They all do all of that for me when I see them. However, not all of my other providers do that as well. So I'm a little bit more sensitive because I know the hormone improvement, like as far as if your hormones improve or they're, deficit in something, we are going to have some symptoms. And that's from personal experience. So I know the value of it. The children I treat, we always do folate and stuff like that so that we can see if there's some deficiency that's causing these mood changes. Anytime there's new onset, I always do the hormone. So depending on the age of the female, there's going to be, you need to find out where your hormone levels are to see if that is the culprit versus just new onset depression or anxiety. I had a patient last week that presented and she knew panic attacks. Never had panic, never had anxiety before. She's 48, right? So she's in that kind of range. And it's like, okay, well, what else have you done? She's like, I'm afraid to leave the house now. New onset. Well, that's not going to be medication right now. We have to figure out. So sent her back and said, here, work with your primary care in that capacity. I need you to find out where your levels are. That's where we're at. So that there's a big proponent. So could I have given her medication? Sure. Does she need it? Maybe, but I don't know that until I have all the rest of the stuff in play because that really does make a difference.
Listen, I hear you, and I find that is a big pet peeve of mine, knowing the wellness world and doing bioidentical hormones. My biggest pet peeve is as soon as you hit menopause, you go to your primary because now you have hot flashes and you can't sleep and you're sad and you're crying at movies and you're depressed and you have no energy. And the very first thing they put them on is they all come in on an antidepressant and anti-anxiety drug. And it really breaks my heart because they're actually more calm, but they're still having palpitations. They still can't sleep. And now I feel like as I fix their hormones, I have to then piggyback and showing them how to decrease their medication and asking them to go back to be a comprehensive panel with other physicians. I never like to say, well, I'm going to take you off that medication or don't talk to your doctor. It really is a collaboration with other physicians to say, listen, we need to figure out how to get this patient off this safely. And because most of those medications need to be weaned off, they can't just be done cold turkey. But these poor menopausal women, I think, are not in a good basket right now.
And it depends on if their provider listens to them, right? So primary care will do that because they're like, oh yeah, that's normal. It's not normal. It's not normal to have the progesterone being so low that you're causing, insomnia. Like it's not normal. So then it's an easy fix. Get her out of the, the room, finish the visit quickly. And that's what I see. I see a bunch that then the primary care will send them to psychiatry because they'll want us to continue the medication management. So then I see them and I'm like, okay, why are you on Effexor?
Right.
Well, I was started on that because I have insomnia and I have night sweats. I'm like, okay, well, where are your hormone levels? Like it's like, this is your age. This is probably where it's happening. So if we help that, do you still need the Effexor? I don't think so because the side effects that come with that are not, ideal for somebody who doesn't need serotonin or norepinephrine to be held on longer for support. So that's kind of where you have to go.
I just feel like it's such a large population. I'm hoping, and maybe you'll see it more than I do. Do you think it's becoming a better trend that we're doing a more comprehensive look? Long are the days that everyone only needs a TSH and CBC. I feel like that was our main lab work. And if you had those two parameters normal, you were okay. There was no other parameters that are being checked on patients today.
Well, they don't do it. I personally went to my primary care and said, look, I'm having brain fog. I don't need brain fog, don't like it, didn't understand it. And, that's normal part of it. Normal part of life. It's like, it's not normal to have brain fog. During times, the third week of the month, every month I'm having brain fog. Like this is not okay. I'm not going to do a panel because I'm not going to treat you. Okay. So that was kind of the hormone. So it is going to be on us as females to say, I need this and advocate for self and find a provider that will do it because they value that, but mine specifically said, I'm not going I don't treat it. So I'm not going to, it's not necessary. Well, it is, I'm telling you my symptoms, right?
Well, and they do. And so when women come in and they say, I'm foggy, you're right, that they'll say, oh, honey, that's just the process of aging. Okay, listen, not the process of aging. We don't need to go down this slippery slope of feeling terrible. And so I always have this little funny saying that if I can sprinkle a little testosterone on everyone, we would have such a happier world, right? We would have memory, focus, lean body mass, energy. Like we would feel great. And I'm not quite sure. And look, good for a primary to say, I don't know how to treat it. Bad for a primary to say, I may not know how to treat it, but you should go get this looked at, right? And believe in that versus guilting someone into saying, well, you're just getting old, honey. It's okay. You don't need to treat it. You don't need to feel amazing the rest of your life.
Right. It's just, I hear more now than I have in the past. So you're probably seeing that hopefully as well, so I want to say that we're moving ahead and there's been more focus on females, perimenopause, menopause, postmenopausal, so I hope that there's a change but it's not enough. It's not fast enough. People are getting started unnecessarily on medication that could have long-term effects.
Yeah. I do hope. I hope that, by doing a lot of these talks and other people out there just educating women and men, right? You have andropause and menopause, that there's no reason to not continuously feel better. And just like we do things aesthetically to feel better, right? Internally, we need to be able to get people to feel like what they used to feel like. Optimize their nutrition, optimize their brain health, optimize their hormones, everything it takes to live a healthier life.
Yeah, longevity, overall just feeling and being present. I think all of that has something to do with it. And that's what you want. That's our goal for our patients and for ourselves. But, we have to get there. That's going to be tough.
We need to kick them a little bit further and try to assist that. And again, I love that you do the lab work. I will say time and time again, our patients come in with zero lab work, and there's a process, right, to understand what's going on. Just like you have to delve deep into what happened in their past, what are they doing currently, but how can we as medical professionals help them and not just label them into a different category?
Right. And say, yes, oh, here you are. Yep, you're depressed. Well, am I depressed, or is my folate level low, or vitamin D is problematic, or anything like that? So I always say yes. So first onset, they either went to the primary care and had a CBC, TSH, all of that, lipid panel, or I'll order it because my medications that I'm prescribing do have an effect on their metabolic conditions. So that's why all are important.
The Formula Wellness 4 cornerstones are nutrition, functional wellness, aesthetics, and brain health. These serve as a guide rail for individuals that are pursuing longevity inside and out. Formula Wellness is setting the new benchmark in preventative healthcare and aesthetics. Thank you for all of your support. To learn more, please visit www.formulawellness.com.
We're allowing all of these other parameters to dictate how we're treating our patients and making them feel better. And I'm always struggling on how to figure out how I can make that better for my patients.
Yeah, it's a hard thing. Same thing in my world as far as, yes, they'll pay for the labs, but only initial labs, right? So that I can't go, okay, one step further, even though I want to. So I make referrals, go follow with this person, endocrine, whatever. And then the same thing with talk therapy. We know, excuse me, everybody would benefit from therapy. Not everybody needs therapy, but everybody benefits from it, right? Most people. There's costs involved in that. So insurance is a little bit better now than it was maybe 7 years ago, as far as paying for it and seeing the need and understanding that is beneficial, so that, there's a positive response to it. But there's the certain percent that it's too costly and they can't do it.
Right. Especially because they need to do it consistently, right? That's going to be, if you're doing talk therapy, you can't just come in once a quarter and have a conversation. There's so much lack of time, that time that you need to get better. I do feel like now it's kind of reversed. When I was growing up, there was a stigma if you went to therapy, right? You were labeled crazy or something was wrong with you. I feel like now it's becoming a trendy thing. And you have everyone from adolescents, children, all the way up to older people getting therapy. Are there any red flags that we're seeing, or is it all okay?
It depends. It depends on the situation. I do believe people being able to talk to somebody and having them guide you, I think is very important, even from kid to adult, right? But where do you draw the line? So if I'm a child or going to get therapy, what is my purpose? Do I have a treatment plan, or am I just looking for something to be labeled as? And I do treat children and adolescents, and I do see that. So ones that are very much struggling with emotional regulation benefit, but the ones who are, my friend is getting it, so now I need to get it. So it's a little bit of a mixed, if you will. But I think that recognizing the need for it is what I would advocate for. So I think if we had more well-adjusted children, they become well-adjusted adults. So identifying the need for coping mechanisms and stuff like that at a younger age would be beneficial.
Yeah. So not so much even as attention seeking, and you probably believe in this, that really comes. The people that see our children the most are our teachers and then people in the school system. So we really rely upon them and the guidance counselors to kind of help our children and find these red flags. That with everything going on in this world today, there may be some kind of miss there.
Definitely. And the money that we would put into mental health, if we made sure that they were getting it at the school level, that's what I advocate for. More mental health, either crisis counselors or more as far as guidance that are for mental health versus picking your classes for next year. No, we need both, right? So we need somebody in place to be able to, multiple people, to say, okay, I see that their stress level is increasing and this is how they're responding. So it's identifying their inability maybe to respond to stressors, or what's going on, and noticing that maybe it is from the home environment's not safe. They're recognizing that when they get to school as well through act out behaviors and stuff like that. So instead of label them problematic in school, we're getting to a little bit more of the crux of what's going on. So making them so that we're identifying, treating, and helping them to be, more emotionally regulated. Yeah.
Right. So we can prevent a lot of the disasters that are happening in this country, right? By just like we want preventative medicine, we want preventative health mental health medicine to help our children not go down that slope, which is so dangerous right now.
There's a definite time when you see teenage, that's your informative years, right? So it's okay, what am I gravitating towards? How am I doing it? How do parents deal with stressors? That's what they're emulating, right? So it's like, okay, this is what I'm seeing. But if they have more emotionally regulated people around them and kind of supporting them, saying, okay, let's talk about it, I think that would be much better for them in the long run.
So do you at your practice have a lot of family therapy? Because I think a lot of times when the children are coming in, there obviously needs to be a balance of the parents. A lot of times there's issues in the home that the kids may or may not want to discuss, and bringing the whole entire family, whether it's going to be a supportive thing or a therapy thing.
Right. I identify the need. And that's how I treat children. So I'd say probably 30% of the practice is children, right? So teens. And when I'm treating them, I am treating the family, right? So their role in the family. But I don't have the time or I wish I could provide family therapy for them. I'm not in that role. So they're the ones that get recommendation. You have to do this, this, and this, because I want to couple my treatment with them with this family unit therapy necessary. Yes. But you do see it.
Yeah, look, we all want well-adjusted children.
Correct. Correct. That is the goal.
That is the goal. Even if we're not well-adjusted, we want our children to be well-adjusted.
To be able to identify that they're not, and what are we doing differently? Yes.
In today's world, I think we've gotten, as I love to talk to all of our entrepreneurs and women bosses, as we call them, right? And we go through all of this, right? We have different seasons of our lives and different things that are important. But I truly believe, mental health, wellness, health, those are all our biggest problems and things that we need to do better. And then we talked a lot about confidence and the way we look, and it's really a portrayal of everything from our outside to our inside, and how we go through that. And there's stigma in that. There's a lot still stigma in the aesthetics world. Do you ever end up having any issues with that, or counsel patients on that realm?
So self-care, we define when we're evaluating for depression, we look at self-care, right? So it's like, okay, well, what does it look like, and what do you feel comfortable with, and where's your confidence level, and where is your self-esteem? So in that conversation, it gears it more to the aesthetic piece of it, right? So internal, external. So, okay, so when we're evaluating for depression is what we're looking at, right? It's not showering for 3 days, something like that, not caring about presentation. When they present to me, are they clean, neat, and ready, for the day, so that's kind of what we look at. And then promoting that, because I am very much promoting that you will feel this way internally if you are taking care of self. And a lot of them I hear, I was told I was selfish. No, you're not selfish. And it's a good piece to be selfish in that interest of promoting self. That's a good thing, so don't feel guilty about it, because it's so important overall to mind, body, and everything else that it's necessary. Yeah. So I'm an advocate.
Look, women always get that thing about being guilty, or we're taking care of ourselves, so that means we're not taking care of others. But if we don't take care of ourselves and we don't feel our best, we're not going to be able to give our best to others. And I think people forget that.
Yeah. No, it's necessary. Yeah. So that's the argument I make. Okay. So if you're not at 100% feeling, ready for the day, how are you taking care of others? We are always caregivers, right? In whatever capacity that looks like. But we neglect. So we're not neglecting self for what? They see that. They're going to learn from that. So I want you to have well-adjusted, kids and people around you that see that you value that, and that's an important piece of it.
Oh, listen, it's definitely a mental health thing for me to go get a massage and relax for a bit, get a facial. Like, I need that downtime to recuperate all of the processes that go through our brain nonstop. As matter of fact, I've heard it from my estheticians all the time. They don't like doing my facials because I give them like 20 to 30 minutes. I tell them is about the limit that I can shut my brain down. And they're like, we just need you for a whole hour to just relax. And I'm looking at them like, what?
I don't have that time. I can't do that.
But it's more that we can't shut it down. And for our mental health, we need to have the ability
Yeah.
to clear our mind and refocus on something that is not busy work.
Correct. And
Mind chatter.
right. Agreed. I see patients at night, right? So what happens with all the internal energy I have to do something. So I could sit there and it would just overthink, but I'm not going to do that. So I go exercise. So I hit the treadmill, depending on the cases. If it's a harder case, I'm on the treadmill for an hour. And it's not so hard. Maybe it's a half hour, but I have to burn that energy off. And it's the same instance. Like I have to be able to, after compartmentalizing all of the stuff I'm hearing, and talking, then what am I doing with it? So I have to be, and that's healthy voting for me. See, that's how I have to do it.
No, exercise is a great therapy, right? So, I mean, there's many people that pick bad things to do. And so I agree, having something that's going to be healthy for your body is a great way. But a lot of people have bad coping skills. Do you give them like some good little options of how to get better coping skills?
Sure. So when we talk, it's about how do you handle stressors, right? So it's okay. What are your coping mechanisms now? They'll give me a list of them. Like, okay, let's talk about healthy versus not healthy, and then we binging with drink at night, binging, eating, drinking, like anything else, and it's okay. That's not healthy. Let's look at healthy versus not healthy and see if we can benefit. Because if you did more of the healthy, your sleep would improve, your nutrition would improve. So you have to look at it on that scale. So yes, I work through it each time I see them. It's always my question, what coping skills were you using this month? And that's what they go through.
And it's interesting because bad coping skills like binging on sugar, alcohol really cause you to feel a lot worse and make your depression significantly worse.
Yeah, it will. Yes, the binge eating, then you get into self-confidence, you get into all of that. The guilt just eats them many, but you have that, and then alcohol. Yes, I mean it's a cycle, causes euphoria, depression, anxiety. The euphoria, so that's not going to help them in the long run.
And in this profession, it's going to be more about consistency, right? Long term, making good choices that are going to help you heal.
Correct.
But like everything else, there's lots of ups and downs. Sure. And that's why I think they have to constantly be part of this realm and get therapy and be committed to getting better
too. So, I mean, everybody's going to have stressors throughout, time, right? We all do. So my concern is the function. If this is causing you to decrease your ability to function in work, society as a whole, right? So that would be, okay, we need to really treat that immediately, right? But if it's more of something new's happening and you just don't know what coping strategy to utilize, okay, let's implement, right? So it's the implementation phase, which many people get stuck on. You know what they should do? It's just in that interest of at that moment, they fail to do it. So it's taking the time to do that step, and that's hard. It's hard because you want to quickly feel better, and it's not gonna happen. Unfortunately, it's a process, and we all want results.
We all want that magic thing that was done yesterday.
That's not happening. No, there's nothing at our reflection. Oh my gosh, that's a tough one.
That's hard, right? Self-reflection, understanding. I think that kind of comes a part of everything. That self-reflection is a beauty thing of how we feel and how we love ourselves internally, which most people are really hard on themselves.
Very much so. Remember, the brain's automatic negative thinking, right? So you automatically go negative. So that's the simple. I had a room of people, and there was probably about 20 people, and I said to them, can you name something positive about yourself? I'm telling you, all of them took like minutes to answer. Like they were thinking about it. And I said, okay, same crowd, give me something negative about yourself. 2 seconds. And it's the truth. So why do we do that? Well, the brain automatically does that. So it's up to us to do different mechanisms to challenge that thought. So if we challenge the thought long enough, it will replace it with something else. And your brain says, oh, she's not that doesn't upset her anymore. Let's move on to something else. And then looks for something else. But it's just how our brain works. So we have to change that.
Yeah, reprogram for the better.
Yep.
I like that.
It's necessary.
You're not going to stop me, right?
No. Not at all.
Okay, so I have to ask us our favorite little question, and that is, and because this has been a really introspective question that people have come up with the most amazing, sincere answers, and that is, what does beauty mean to you?
Oh, I mean, aesthetically speaking, you could say internal, external, but for me, it's more about the energy produced. So it's a lot of times it's that people want to gravitate towards you. People feel that energy that you exude, and you honestly, truly want others to feel better. So you feel that. You feel that kind of connection. And that's beauty to me. It's the ability to present yourself in a way that people want to be around you. And also, they understand that they can come to you because they want you to feel better. You give this energy that makes them feel better about themselves. I like that.
I love that. So beauty is more energy and connectivity.
Correct. Yeah.
I like this. Look at that. I'm going to use that one. But he gets it. Not put it. That was amazing. I like that. Energy and connectivity. I mean, that's what beauty means to you. Thank you so much, Jennifer, for being on our podcast. I really, truly enjoyed our conversation.
You sure are welcome. It was a great time. I thank you so much for having me.
Thank you. And go make the better place. Make everybody feel better.
I hope so.